2, 3, go. शेयर गरौँ।
एकैछिन म यहाँ अब त्यो खोज्दैछु कता गयो फेरि यो सेयर गर्नै फेरि मलाई आएन सेयर गर्नलाई
हरियो मार्छ शेयर भनेर लेखा छ बिचमा
डेस्कटपमा जानुपर्ने हैन खै त डेस्कटपमै पावर पोइन्ट पहिले खोले आउनुपर्छ हो
पहिले खोल्ने हो
एकछिन है त म खोलिहालेँ खोलेको बन्द गरिदिन्छ कि
अहिले खोलेको हैन र
खोलेको फेरि बन्द भयो अपना आयुर्वेदा इन्सोम्निया अपना प्रेजेन्टेसन ल यो खुल्यो गुरु हैन अब सुरु गरौँ हेलो
सुरु भइसक्यो अघि नै
ए ल त्यसलाई पछाडि अगाडिको काटौँला फेरि त्यसो भए हेलो नमस्ते
त्यो फुल स्क्रिन गर्नु नि डाक्टर साहब अघि पनि यही भनेको थिएँ मैले
फुल गर्ने कहाँबाट हो गुरु
त्यो त्यो पावर पोइन्टकै त्यो कप जस्तो हुन्छ नि त्यसमा जाने दाहिनेपट्टि हुन्छ
ए हजुर एकैछिन ल अब भयो
भयो ल अल द बेस्ट डाक्टर साहब
थ्याङ्क यू नमस्ते एभ्रिवान नमस्ते Dr. Shekhar thank you for providing me this great opportunity today I am going to present Ayurveda and insomnia topic on the auspicious occasion of International Ayurveda Conference. Myself, Dr. Buddi MD Ayurveda, Kaya Chikitsa Internal Medicine, Medical Director and Senior Consultant, Ayurveda Specialist at Atre Arabi Mandir and Research Center, Buddi 12, Kathmandu, Nepal. Today's my presentation outline is sleep medicine. I will talk about sleep medicine and global burden of insomnia, sleep and insomnia in Charak Samhita, sleep and insomnia in Susrut Samhita, sleep and insomnia in Astanga Sangra and Astanga Hirde, sleep and insomnia in other traditional treatises, Ayurveda aspect of management of insomnia, role of Atre Ayurveda lifestyle, and lastly the conclusion. Sleep medicine. Sleep medicine describes understanding of sleep disorders, sleep-related disorders, diagnosis of insomnia and treatments. Introduction of sleep medicine. Sleep medicine is a medical specialty for diagnosing and treating sleep-related issues. Interdisciplinary fields are neurology, psychiatry, pulmonology, Ayurveda, and psychology. These all fields are related to sleep and insomnia. The sleep medicine is key to mental, physical, and emotional well-being. Importance of sleep. Sleep restores body and brain, enhances memory and mood, strengthens immunity, regulates hormones and metabolism, supports cardiovascular health. Sleep physiology. There are two major phases of sleep: REM sleep and non-REM sleep. REM sleep is dream state and brain is active at that time. And non-REM sleep is deep sleep. In that situation, the body repairs the tissues and body dhatus, and the cycle is 90 minutes each, repeating through the night. Common sleep disorders are insomnia, that is difficulty in sleeping. This is the topic, our today's topic. And another sleep disorder is sleep apnea, breathing interruption during sleep. Another is narcolepsy, sudden sleep attacks, restless leg syndrome, parasomnias, that is sleepwalking and nightmares, and circadian rhythm disorders. These all are common sleep disorders. Diagnostic methods are polysomnography, actigraphy, sleep diaries, and Epworth sleepiness scale measures daytime drowsiness. These are the tools used in higher centers for insomnia. And pharmacological therapy in modern medicine, sedatives, melatonin supplements, and antidepressants are used. Non-pharmacological therapies are cognitive behavioral therapy for insomnia, sleep hygiene education, meditation and relaxation, CPAP for sleep apnea, light therapy for circadian shifts. Ayurveda in sleep medicine. Ayurveda describes many more on sleep and insomnia. It is very rich medical science, and Ayurveda gives many solutions to insomnia. And in modern fast growing world, insomnia is a common public health problem, and Ayurveda helps therapies, practices, and diet help in the management of insomnia. Common herbs are ashwagandha, brahmi, jatamansi, sarpagandha, etc. And therapies are abhyanga, sirodhara, nasya. Practices are, that is dincharya, ritucharya, yoga nidra, usually the Ayurveda lifestyles. And diet, light, digestible food at night. And effects of sleep are that disorder, sleep disorder, and insomnia causes obesity, hypertension, depression, weak immunity, low productivity, accidents and injuries. And preventive measures are regular sleep wake-up cycle, avoid screens and stimulants at night, quite dark sleeping environment, relaxing bedtime rituals, balanced diet and exercise. Future sleep medicine. The AI is occupying all the fields, and sleep also can be AI assisted sleep monitoring, telehealth sleep consultations with the help of that AI, and wearables and smart mattresses, and integrative medicine approaches like the modern medicine and Ayurveda medicine. Ayurveda can fill the gaps of that modern medicines in case of insomnia. And public health awareness campaigns should be performed by the health agencies of each and every country around the globe. In conclusion, the sleep medicine addresses modern health challenges. Sleep is a vital pillar of health, combines modern and traditional approaches, invests in sleep for longevity and vitality. Good sleep is vital for good health, mental health, physical health, spiritual health. So the countries should invest in sleep for their citizen. Now I am going to talk about the global burden of insomnia. What is the data regarding insomnia? Approximately 10% of the adult population suffer from an insomnia disorder, and another 20% experiences occasional insomnia symptoms. Women older adults and people with socioeconomic hardship are more vulnerable to insomnia. Insomnia is often a chronic condition with a 40% prevalence rate over a 5-year period. Insomnia is a uh, significant public health problem that should be addressed at the individual level with appropriate clinical care and at the population level with large scale sleep health interventions. Insomnia is common global health concern. Ayurveda Nidra is one of the three pillars of life. Trayukastamba, Ahar Nidra Brahmacharya is explained in Ayurveda. These three are the three pillars of life, and Ahara, Nidra, and Brahmacharya, all three are equally important to maintain good health. Modern management is the modern medical treatment develops dependency and side effects. Like if somebody starts taking that sleep medicine, they have to take for lifelong. And there are many side effects, like if people is using benzodiazepines for a long time, that causes liver damages, and there are many other uh, side effects. And the people taking those psychotropic medicines are not in actual natural mood, and they are in altered mood, so their work efficiency is also hampered. So Ayurveda offers uh, root cause treatment and holistic approach in the management of insomnia. So Ayurveda is very much important, and this conference will provide a good message to general public globally. Uh, all speakers will provide their view and a definition and nidana. Um, Anidra is disturbed sleep or lack of restorative sleep. The causes according to Ayurveda is Vata Pitta aggravation, stress, irregular routine, Vishama Ahara Vihara, Vega Dharana, sensory overload are other causes. And Samprapti, according to Ayurveda, the aggravation of prana and udana vayu, disturbances in Tarpaka and Sadha Kapha, and the Rajasic and Manasic imbalance affecting the mind are the pathological causes of insomnia according to Ayurveda. And types of nidra can be classified as Vataja, Pittaja, Kaphaja because these three are the main body humors of our body, and they are responsible for health and illness of an individual, and the equilibrium of dosas is a healthy condition, and the imbalance is disease condition. Management approaches are Nidana Parivarjana. There are three major management principles in Ayurveda. That one, the first is Nidana Parivarjana. The cause should be removed, avoidance of that causative factors. Another is Shodhana Chikisa, that is Panchakarma. Abhyanga, Shirodhara, Nashya, Basti, deep clinical massage, all are Shodhana Chikisa. And Samana Chikisa, in Samana Chikisa, we use medicines for the treatment of disease. And another important aspect of Ayurveda is Ayurveda lifestyle, that is Dinacharya, Ritucharya, Achara, science, deep. All the things are very much important for the management of that insomnia. And that Dincharya describes diet and daily routine. That is warm milk with nutmeg before sleep, especially the buffalo milk, and avoidance of that coffee, spicy food, and heavy foods at night, and fixed bedtime, calming evening rituals are important. And psychological and spiritual tools are Achara Rasayana, ethical living, calmness, Yoga Nidra, pranayam and meditation, spiritual counseling, Charak and Bhagavata, Gita, Charak and Srimad Bhagavad Gita insights are spiritual counseling, and evidence and research helps improve sleep latency and quality. Sirodhara calms limbic system, and combining cognitive behavioral therapy for insomnia with Ayurveda is synergy. These are the research guided that successful tools for the management of insomnia. Public health relevance. Insomnia is linked to NCT. NCT is pandemic globally now. One of the causes of that NCTs is insomnia, like the NCTs are hypertension, diabetes, degenerative musculoskeletal disorders, anxiety, depression, etc. And community-based Ayurveda interventions are possible. Atre Ayurveda lifestyle in schools, universities, and workplaces are equally important. I'll talk about Atre Ayurveda lifestyle and coming slides. Conclusion: Ayurveda treats root cause, ensures sustainable results, integrates physical, mental, and spiritual health, bridges ancient wisdom with modern science. There are many gaps in treatment of entities in modern science that can be fulfilled with the help of Ayurveda knowledge. Now I am going to talk about that. In short, I am going to talk about the sleep and insomnia mentioned in different Ayurveda classical texts. This is about the sleep and insomnia mentioned in Charaka Samhita. I am going to skip fast because I have limited time to explain all the things. But this is introduction according to Charaka. Charaka says that sleep is one of the three vital pillars of life mentioned in Ayurveda. Charaka Samhita describes it as essential for health, happiness, strength, and longevity. Insomnia is seen in pathological disturbances of natural sleep. The definition of Nidra in Charaka Samhita is Nidra tu manaso sthanam Gyanendriyanam cha vishranti. Sleep is the resting state of mind and sensory organ. It occurs when tamaguna dominates due to fatigue. The causes of sleep according to Charaka Samhita yadatu manasendriyanam cha klantanam visrama hetu tamogritiir bhavati tada nidra bhavati. Fatigue of mind and senses, withdrawal from sensory activities, dominance of tamas guna, natural circadian rhythm, all are the causes of that sleep, natural sleep. And Charaka Samhita describes 6 types of nidra, that is Swabhiki, Vaikariki, Agantuki, Aushadhi Janit, Vyadhi Janit, Kilesha Samithita. And importance of Charaka Samhita mentions the importance of sleep, that is Sukham Dukham Pushti Kishata, Vriddhi Rasam Jivanam, Mirtucha Nidra Sampate Vipate Bhavata. These are the importance according to Charaka Samhita, that is happiness and sorrow, nourishment and emancipation, strength and weakness, growth and decay, life and death, all are the points mentioned in the importance of sleep. And the insomnia definition and causes of insomnia according to Charaka: Ratrau no nidrayati sa sukham prapnoti na kinchana. This is the definition and cause of insomnia according to Ayurveda. The inability to sleep at night. And main causes are aggravation of Vata dosha, dominance of Rajas guna, mental disturbances, irregular life cycles. Symptoms of insomnia are difficulty sleeping, frequent awakening, light or restless sleep, irritability, fatigue, and poor memory. How Ayurveda management of insomnia, there are many. I also previously mentioned that there are herbs, Brahmi, Sugandha, Datamanchi, Panchakarma therapy, Sirodhara, Benganesha, mental therapy, Saptavadi, Chikisa. There are many points in Saptavadi, Chikisa. We all Ayurvedicians know. And lifestyle correction, that is sleep hygiene should be maintained, sleep routine should be maintained, and the light diet before sleep is important. And conclusion, according to Charak Samhita, Nidra is life-sustaining force. It results from insomnia, results from lifestyle, mental, and dosic imbalance. And Ayurveda offers holistic, natural management strategies for sleep health. Now I am going to talk about Susruta Samhita. Susruta also describes sleep as three pillars of life, one of the three pillars of life, and it elaborates causes, type, importance, and disorders. This is the definition in Susruta. Nidraya Yuktamayusya Sukham Pushti Balapardam. It provides life, happiness, supports life, happiness, strength, and nourishment. And causes of sleep, this is according to Susruta. Sarirasya klante santo manosurastana suvaviti chasanidra. Physical fatigue, withdrawal of mind from senses, and tranquility of mind are the causes of sleep. And Susruta also describes six types of nidra. And importance of sleep, according to Susruta, is Bala, Arogya, Pushti, Ayu, and Santushti. That is, Bala is strength. Sleep increases physical strength. Arogya is health. Proper sleep increases immunity. And Pushti, nourishment. Sleep provides nourishment to body. Ayu, longevity. Sleep helps in achieving long life, and it helps in healthy aging also. Santushti, mental satisfaction. Sleep brings mental balance and peace. And causes of insomnia, according to Susruta, Vatavitti, Chinta, Soka, Vyadijanya Avastha, that is disease and disorder, and overuse of stimulants and intoxicants. Symptoms are difficulty in sleeping. There is inability to sleep despite physical fatigue, feeling tired in the morning. According to Charaka Samhita, Vimana Sthana, there are 13-14 signs of that physical subjective well-being. That says one should feel lightness while awakening, but here feels tired, continuous thoughts running in mind overnight, poor memory and concentration. Effects of chronic insomnia: physical weakness, mood swings, reduced immunity, anxiety, depression, poor memory, and reduced cognitive functions, and risk of non-communicable diseases. And management of insomnia in Ayurveda is Abhyanga. We already told that Panchakarma is very much important in the management of that insomnia. Abhyanga, Sirodhara, Siddhavasti, Snigdhavasti, Medyarasayana, and lifestyle and behavioral modifications, mental and emotional health are important. Conclusion: Susruta also provides holistic tools to address insomnia. Ashtanga Hridaya and Ashtanga Sangra also discuss about that sleep and Nidra. These are the slides mentioned in the Ashtanga Sangra and Ashtanga Hridaya. Here are some ideal times and duration of sleep mentioned in the Ashtanga Hridaya, and benefits of sleep and causes of insomnia are also mentioned in Ashtanga Sangra. And there are different type of sleep pattern, and Ayurveda management given in that Astanga Hridaya. And sleep requirements by age. According to age, the sleep in childhood, the sleep hours are maximum, and in elderly people, the sleep hours are minimum. And management of insomnia is that the Snehana, Swedana, medicated ghee, and that Medha, Medya Dravya, and Ayurveda lifestyle, and that dhyana, pranayama, and yoga, other wings of yoga are helpful in management of insomnia. This is the conclusion of the Astanga Hridaya. And in Ayurveda, other Ayurveda treaties also, insomnia and sleep is explained. And in Madhava Nidanam, there is a description of insomnia and sleep. In Bhagavata commentaries, in Dharma Sutra Tika, in Himadri, in Vaishadhi Ratnavali, and other commentaries also reinforce the role of Vata imbalance and use of sesame oil, syrup, and emphasized. Main causes of insomnia are Vata Pitta Kapha imbalance, mental stress, impure blood, and lifestyle habits. Ayurveda aspects of insomnia management are that Vata Pacifying therapy, Japanusudam Sirodhara, clinical massage, Marma therapy, and Ayurveda nutrition. Ayurveda nutrition is a big topic. There are many Vedic food, Ahara Vidhi, Ahara Sanskara, many things are there. And Ayurveda lifestyle, there are many Ayurveda lifestyle. I will talk under the heading Ayurveda lifestyle. And yoga and Shata Chakra meditation is also important in the management of that insomnia, and some herbs are important in the management of insomnia, that are Brahmi, Ashwagandha, Shatavari, Vitamansi, Sarvadana, etc. So the integrated focus on integrated mind, body, and spirit approach is the Ayurveda approach in the management of that insomnia. Now I am going to talk about that Atre Ayurveda lifestyle. This is coined by Atre Arodi Mandir and Research Center, Pradhan Country to Kathmandu, Nepal. Myself, Dr. Prasad Purniman, this institution, and I am practicing these Ayurveda lifestyles in the management of non-communicable diseases. I prefer preventive and promotive aspects mentioned in Ayurveda, that is Swasthasam, rather than medication, that is Atureshit Gyara Pasmanam. Introduction, this is I already told, and these are the positives and health impacts I already told. Now I am talking what are the Atre Ayurveda lifestyle. I have applied for the copyright of these points, and I am doing research on these topics in the management of many non-communicable diseases, including insomnia. These are from Ayurveda text and organized in the name of Atre Ayurveda lifestyle. Those are Dincharya, Ritucharya, Achar Rasayan, Swati, Vedic food habits, Sanskrit Mahabhashya. I use that Sanskrit Mahabhashya also in the Ayurveda, Atre Ayurveda lifestyle, because the Sanskrit is a positive language. There are no negative words, and there are many mantras, many meditation techniques, mudras, all the things. So this is important. And another important thing is spiritual psychosocial counseling, what I prescribe for my patients, and these all are very much important in the management of non-communicable disease. And I have presented in World Ayurveda Congress in Dehradun this the last time. My saying is that these Atre Ayurveda lifestyle should be incorporated in the school health education, university health education, and in national health policies of each and every government globally. We will do that advocacy for every government and with the WHO also. And Dincharya, we know that is in my Dincharya, I start Dincharya from that Paramamuhurta. And I prescribe Paramamuhurta sadhana for my patients. And I prescribe that deep clinical massage of Benga. And Pada Benga is good for sleep. And Balarda Vam, I prescribe people Balarda Vam. There should be sweating, tachycardia, tachypnea, and post feeling of post exercise relaxation. These are the key points to meet the need of exercise. And timely meals, digital fasting, and bathing and buffalo milk before bedtime is my advice to my patients. And seasonal and behavioral goods, that is Ritucharya. Here are three things. We should mind the place we are living in, that is Desa. We should mind that Ritu Sandi, and we should follow Pada and Chikram. I do educate my patients in these fields. And another is Vedic food habits. These are, I prefer Sattvic, advise people that Sattvic foods, and I teach them Ahara Vidhi Vidhana, and I tell them to take that light food before that sunset in the evening, and no late night screen time. And another important thing and interesting thing is fiber. I have postulated a formula of that 5 ovens. That is the nature of oven, that oven of nature, oven of kitchen, oven of GI system, oven of cell, and oven of mind. These are important in that managing a non-communicable disease. I will talk in detail in later presentations. Today I have no time. My time is going to be finished, so I am skipping this. And early light dinner before sunset is important in the evening time. And that is Atri Ayurveda lifestyle for insomnia. I have that tutorial for that. And that is I prescribe people the digital fasting, dhyana, mantra chanting. I prescribe 2 books, that is Gita and Nityakam Puja Prakash for that mental issues. This has a good result, and I prescribe taking bath and well massage at sleeping time. Pada Benga is also advised, and regular yoga and sleep hygiene is prescribed. And I have that in spiritual, in Atri Ayurveda Brahma Sadhana, I have that yoga lessons, and therapies are there. Deep clinical massage is another my that own clinical skill developed by Atri Ayurveda Mandir. And research shows that Ayurveda gives good result in insomnia. And conclusion is insomnia is a lifestyle imbalance. Atri Ayurveda lifestyle realigns body, mind, and rhythm. Ayurveda is not just a treatment; it is a way of life. This is my references. Thank you, one and all. Thank you, Dr. Shekhar, for providing opportunity in this wonderful program. Thank you.